Hello, everyone, and welcome to the SNAP's COVID-19 office hours. My name is Micah Webster with Apt Associates. I'm going to spend a couple of moments going over some tech notes, and then we'll get into the content that we have for today. So a couple of housekeeping reminders. We are recording the office hours today, as we do for each office hours, and we will post a copy of the recording along with the slides and any content that we receive through the chat box onto the HUD Exchange in just a few business days. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up there on the screen and that I have just pasted into the chat. Everyone will remain muted for the duration of the office hours this week, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. To find the chat, just take a look at the bottom right-hand corner of your screen. You should see the word chat and what looks like a message bubble. Click on that to open the chat. Please send all questions, comments, and feedback through the chat. And with that, I'm going to turn things over to Ebony Rankin from the HUD Office of Special Needs Assistance Programs. Ebony?
Hi, good afternoon, and thanks, Micah. Today, welcome to our February office hours. Today we have our usual rundown of panelists here. You have some folks from the Office of Special Needs Assistance Program, myself and Brett and Sharon to answer questions. We do have someone from the CDC to give their highlights. Next slide. And then you see other resources that we normally have on some of our office hours calls. Next slide. So the first we will have is a COVID-19 monkeypox update from Emily Mositas from the CDC. Emily?
Hey everyone, it's really good to talk with you today. Normally Caroline Waddell from our office provides this update, but she's out, so I am providing it this week. I'm going to talk about COVID-19 impacts and then the end of the public health emergency for COVID-19. Next slide. So if this winter you were feeling like COVID-19 was nothing like last winter, you would be correct. On this graph, you can see that this winter, all we saw in terms of COVID-19 cases so far, I hope not to jinx this, was a little bubble that you can see on the right-hand side of the graph. We are up to mid-February now, but what you can see last year is the huge spike of the Omicron cases. So so grateful that we did not see anything like that this year, and hopefully we'll continue on this trajectory. Right now, we continue to see a downward trajectory for cases and hospitalizations. Next slide. That means that the COVID-19 community levels are fairly low across the country. There are still some that are high. So if you are in a county where COVID-19 activity is high, these community levels, remember, they represent burden of disease. So they're telling you about how many people are being hospitalized, how many inpatient beds are being used, and that that tells you how much activity is going on and how much it's impacting the population. So when your community is in high, we do want some protections to be in place for people experiencing homelessness so that COVID-19 does not spread easily through shelters. Next slide. We are seeing a shift in the variants. So right now, the most common variant that has been on the rise through this winter bubble that we've been seeing is XBB 1.5, which is a subvariant of Omicron. These variants, again, they will come and they will go. If there is any need to modify prevention measures based on a variant, we will let you know, but as of now, the same prevention measures should be in place. Next slide. All right, and now an MPOX update. Next slide. So more good news here. We are very much in a long tail end of the MPOX epidemic that peaked in August. Right now in the US, we are seeing cases around 2 per day. So very small numbers. We are, CDC's emergency response to mpox closed. So CDC opens emergency responses when there's an outbreak or an epidemic, and so this emergency response opened in May or June and then closed down at the beginning of February. So our team still works a bit on mpox. We will have some specific data on mpox and homelessness that will be coming out in the next couple weeks. Overall, we do know that there were several severe cases of mpox among people experiencing homelessness. So just something to be aware of in case of future outbreaks. Next slide. Okay, so that's the end of my slides, but I did want to mention a little bit about the public health emergency declaration ending. That does have some implications for CDC, but not too many. So I want to just clarify what those implications are. So first of all, the end of the public health emergency declaration does not mean that COVID has ended. We can still see there are many cases per day, and there continue to be deaths. So CDC is going to continue to be working in this area to prevent severe illness and death, in particular among populations who are at high risk for disease. Also, something that I do want to point out is that some questions have come in about whether or not the end of the public health emergency means that the vaccine distribution program will be ending. This currently doesn't have implications for that or for transition of vaccination to commercialization. So that's not what this means, but if there's any movement in that area, we'll be sure to provide that information as soon as possible. So I do want to mention there are a couple data implications for the way that CDC can collect data based on the public health emergency. Most of our COVID-19 activity areas will not be affected. So we'll still be able to get case and death reporting. We'll still be able to do genomic surveillance, wastewater surveillance, traveler surveillance. But some things are going to change a little bit. We won't be able to get hospital data in the same way it was otherwise coming in through CMS on a daily basis, and that's probably going to change. And also negative laboratory results will not be able to be, or they will likely, there will be a change in reporting levels of negative laboratory results. So what does that actually mean to anyone? What that means is that when we're looking at transmission levels on the CDC website, those might be impacted by those changes in data. But what we use for homelessness guidance is the COVID-19 community levels that I showed that map. Those community levels are not going to be changed by these modifications due to the end of the public health emergency. So the guidance for homeless shelters, homeless service sites, that will stay the same. You can still use the same indicators to measure risk for a particular facility. It's really just a couple pieces more related to healthcare settings that are going to have some modifications. If you have any questions about that or any concerns, feel free to reach out to me. I'll put our special populations email into the chat, and I'm happy to take any questions.
Oh, thank you so much. I don't see any questions in the chat right now, but it was really good information, especially the clarification on what does the end of the public health emergency means. So next slide. Okay, next we'll have our HUD TA spotlight. We have Stacy Matthews who will be given the spotlight.
Thanks, Ebony. Hi, everyone. As Ebony mentioned, my name is Stacy Matthews. I use she, her pronouns. I'm Black. I'm on the land of the Susquehanna people in Jessup, Maryland. Really glad to be with you all today. I'm a HUD technical assistance provider working with the disaster response team. As Emily mentioned earlier that the public health emergency declaration is ending, but we know that we need to remain vigilant as it relates to our homeless populations. And so to that end, I'm going to share some that are specific for programs serving people experiencing homelessness. Next slide, please. So the first document that we're going to talk about here on the assessing appropriate COVID-19 prevention strategies. Uh, excuse me. And the link is going to go into the chat right now from my colleague Karen Brown. This is a companion piece to the recently updated CDC guidance on congregate settings. This document is specific to homeless service sites and can act as a blueprint for how communities can effectively implement these recommendations. It outlines how communities can think about their everyday strategies, and in times of high COVID transmission, it also provides enhancements that can be added to address the heightened need. It guides folks to the best practices around how to go about making decisions about prevention strategies and who to include in that process. The document itself is pretty high level, but provides links to more in-depth resources for all of the recommendations that are included. It provides strategies for assessing risk in individual sites, facility considerations like ventilation and layout. It includes information on individual preventions like sanitization and cleaning, medical prevention, assessment and treatment, such as vaccination and testing, and isolation and quarantine considerations. It's really a great piece that can provide simple, clear guidance, and I hope that you're able to share it with the partners in your community. All right. Oh, sorry, next, I already covered that slide, sorry. I forgot to say next slide again. So this is the third time that we're going to be mentioning the infection control and winter planning videos. This series, we are happy to report, is now complete, and all 5 videos are available on the HUD Exchange. And the links going into the chat right now from my colleague Karen. So I'm going to go through the series and just talk about each of the components. So the series itself was created to assist your community in its winter planning and infection control measures. The target audience for the series is shelter providers, continuums of care lead agencies, and others who serve people experiencing homelessness. Again, I'm going to give that brief overview of each of the modules here, but I do want to say that they are all very brief, like 10 minutes each. We hope that they're easily digestible for folks, so you don't need to be a public health researcher or understand the public health language in order to use these documents. The first video is about general infection control measures, The goal of this module is to teach folks about infection control measures so you can mitigate the spread of contagious viruses. That includes viruses like COVID-19, the flu, RSV, norovirus, and Mpox, formerly known as monkeypox. As more people move indoors for colder weather, it's important to maintain strong infection prevention and control practices to avoid spreading and keep all staff, volunteers, guests, and residents healthy. Infections, especially respiratory viruses, can spread quickly without adequate infection prevention and control measures in place. So we hope that that first video has been helpful to you. It's been out for a little while. Video 2 is intended to explore guidance on developing a communication strategy to educate staff and residents about infectious disease. This module will also help shelter and COC lead agencies develop effective communication strategies to keep staff and residents safe during the winter months. And then the latter 3 videos, video 3, 4, and 5, are newly released. And so really hope that you will take some time to head over to the exchange and check them out. So video 3 gives guidance that will assist COCs, shelter leadership, and staff to design their winter plans, to update policies and procedures as needed, and provide information on the day-to-day management and operations of your facility. Cleaning and disinfection are critical for infectious disease mitigation, and will share the most up-to-date information to ensure the safety of your facilities and to protect your employees and residents. Module 4 is focused on isolation and operational considerations for congregate settings like emergency shelters. And this includes isolation in place and cohort strategies to consider. And lastly, Module 5 focuses on isolation and operational considerations for non-congregate settings like hotels and dormitories. What we hope is that you'll find these valuable, and it builds on and organizes the guidance that has been released over the last 2 years. And it helps communities with real and actionable steps to improve their winter planning efforts. Finally, on the next slide, please. We want to make sure folks know about these resources that the video series was really built on. The things I talked about today are probably less than 1% of what's available to communities on the HUD Exchange. And my colleague Karen is putting the links to these in the chat right now. A lot of the content in the series I just talked about is built from these existing resources. And if you have specific needs in your community, there's a very good chance that HUD has already produced guidance to assist in navigating that very issue. I would encourage you to check out what's available to you, and I thank you for your time. Back to you, Ebony.
Thank you, Stacy. There's a lot of resources, and I really appreciate putting the links in the chat for folks to copy and use. Next slide, please. And I was checking to see if there's any questions. Right now, it doesn't look like there are any questions in the chat. But someone did ask if there's a HUD resource that's specific to winding down of COVID response, please share the link. And Sarah, I'm not sure, but I don't know if you want to take this.
Yeah, I will definitely do a little research, see if I can find anything that's specific to the wind down. I know that we are right now looking to see how we can support communities in that way. And there may be some things on the horizon, so I'll take a look.
Thank you. And I just want to let everyone know that you can continue to put your questions in the chat. And as you can see, it looks like Emily from CDC has been answering some questions. So please, if you have questions, please feel free to put them in the chat. And so next up, we have our ESG CV grant updates and Sharon Singer from the SNAPS office.
Hi, folks. Just wanted to give you a quick update to see where things are at. Micah, if you can go to the next slide. The soap opera continues as we continue our drawing down. Most folks are doing great. As you can see, over half of our recipients are over 80% drawn, which is terrific. And a good chunk, 34% are 60 to 80% drawn. And then we have folks who are kind of in the middle and straggling behind. So, you know, we just encourage you to keep up working to get those dollars obligated and spent and out the door. If you can go on to the next slide. So at this point, 75.6% of the allocation is drawn, which is significant. We also have 96.6 million that's not committed in IDIS, and then some of the reallocations, 7.8 million, are not in IDIS. So much smaller numbers, obviously, but still something that our leadership is eager to see that those dollars get used on the ground. You can go on to the next one. So, you know, draw rates are down, not significantly, but slightly over what was the trend at the end of last year. So we really want people to take this moment to assess where you are on your progress to fully expending your funds by the September 30th deadline. So do keep in mind that you do want to save some funds for closeout, for HMIS data, for admin, for all the reporting and reconciling your data, and that those dollars need to be spent by the end of 2023. So really, we would say this is the time, if you have not already reached out for assistance, technical assistance for an AAQ or more hands-on, we really ask that you reach out. We're here to help. We have, as you saw, lots of good resources that are already out there for you to look at. I think the question that was just asked is a good one about sort of winding down in terms of what that looks like on the ground. So please, you know, we are here to help and make sure that these funds are spent and spent well to help folks be safe. And Ebony, let me know if there's anything in the chat. If you can go to the next slide. So just so folks know, we are working on guidance and timelines for closing things out. We're in the midst of doing that. There will be a closeout training date to be determined. And if you have fully drawn your ESG CV, or when you have, you can close out your quarterly reporting. There is guidance in SAGE on how to submit your final report. Again, reach out to the AQ if you have any questions. And it looks like you can link back once the slides are shared in the office hours from September, and there's guidance on that. But there will be, you know, continued outreach from our office to folks over the coming weeks. And I think that is it. And I will pass it back to Ebony.
Thank you, Sharon. And as we look to see if there's any questions, there will be a rotating 3 slides or so with some of the other resources we have available that most people who've been on this call have seen these resources before. So let's see, we have one more question in the chat. Catherine asked, when should we expect grant agreements to be available for the unsheltered NOFO funding? So I think last week or the week before last, we sent out an email to those recipients who were announced in our first announcement for the special NOFO for unsheltered and rural, that we will have a upcoming webinar. We haven't put out the information yet, but we will have a webinar that will explain a little bit about expectations in the TA for the special NOFO, the unsheltered and rural NOFO funding, and what you can expect and that sort of thing. So that'll be coming soon. The grant agreements will be available. It will be after, you know, we finish. We're still in our competition mode because we have another announcement. So nothing will happen until after that second announcement. So do we have any other questions? I think that's the only one I see so far. The regular COC competition announcement, we are working on that. It will be soon, like in the next few weeks. So we are working on finalizing numbers and getting everything ready for that announcement. So it's really soon. Any other questions? The 2022 COC Awards. So that is the 2022 COC Awards is the regular COC competition announcement. So that's what I was talking about just a few seconds ago about it'll be really soon. Anything else? Yes. Let's see. Of course, when Norm's not here, I would get all the questions about the NOFO. So yes, the NOFO is still in the stages of development right now. So if you follow the NOFO timelines for the past few years, you can kind of see where it goes as far as the next NOFO. I really don't have a prediction of when our FY 2023 NOFO will come out. I don't know about the home ARP implementation guidance email will be answered. I'm not sure about that, but I can always go back and look to see what that is about, because I haven't heard of the home ARP implementation guidance. Any other questions? Okay, I think that is all we have for today. So thanks everyone for being on the call, and we will see you next month for our COVID-19 updates. You have a good weekend, everyone.